Okay, thank you so much. Good morning, everyone. It's a pleasure to have be here today among such dedicated professionals. So myself, I'm Nasif Mahmood. I'm from Uttar Adhunik Medical College and Hospital, Bangladesh, and share my insight from my case study, which mainly I focus the implications for nursing practice and leadership in response to mpox, lessons from a cross-sectional study in Bangladesh. I selected this case from my curiosity when there's suspected case I found in Bangladesh, June 2024. Then I started this case study amongst different health professionals like nursing students, medical professionals, dental students, and all other health care professionals in Bangladesh. And I have collected totals 100 data and including 43% are nursing students. So I today my basically I'm focusing on the nursing led groups and nursing subgroups in these conversations and nursing case. So I have collected 43 data and I collected for 43 data. The study contains and objectives I mainly focused on the preparedness and knowledge gap and practical challenges during infectious outbreak like mpox. And their objectives is understand their preparedness, knowledge gap, and practical challenges during infectious disease outbreak. Um, the nursing of the future combat for this combating infectious disease and in the knowledge levels. Can you please? In this case study, we at this nursing student, they have the knowledge about infectious disease. The nursing student, in my case study, I see that distribution of primary information source. The most of the nursing students, all also knows about the heard about the mpox virus, and the 50% of those get the information from social media, news media, and other sources. So there is a gap that the curriculums on the or the academic source they don't have not much information about mpox viruses. So there's a between the formal training. Also, in my case study, I see that 30% of the identify mpox as zoonotic disease. So the maximum 70% they don't hear that this is a zoonotic disease or a communicables or an environmental kinds of disease they don't know, and 40% are receiving formal training also. So there is a gap that they don't have receiving a formal trainings in infectious disease like mpox. Can you share the second slide on? Thank you so much. Prevent it, and then we come the nursing student equipped prevent about infectious disease. In this case, I merely highlighted the hand hygiene practice nursing and preferred preventive measures for mpox. I see that 60% of the nursing students are they practice hand hygiene like they were, and after handling animals, the mpox can transmitted through the it is a zoonotic disease and then and transmitted from animals to humans so easily. So the hand washing by hand hygiene is must in these cases, and 20% occasionally follow hand hygiene protocols. And we can see that 25% of the nursing students are use a personal protective equipment, and 30% they don't rarely or never use this personal protective equipment. Then we go to the preventative measures. 40% I see that 40% of the nursing students avoid contact with suspected cases, and 30% prioritize wearing gloves and masks. We can say that there is a we can say that there is a there is a chances that they have a lack of knowledges, or they have don't any trainings, or any inadequate supplies. So we can also mention that there is inadequate supplies of personal protective equipment, or um, they have a lack of knowledge in this regards. I can see that. Can you see the next slide? In my next slide, I have said that there is a challenges nursing student. What barrier do nursing student encounters in my country like Bangladesh? So there's I say that when I go to the nursing institutions with my colleagues, I've mentioned that my nursing colleagues are not available to here today due to some examinations in their institution. Um, when I go to the nursing institutions along with them, I see that I when I ask some of them on colleagues and nursing students, and that they face some barriers in regarding in handling the infectious disease like mpox. So they said that they have inadequate training, they have resource training, and misinformation risk. So in educate training, they say that there is a limited exposure outbreaks, specific protocol in their educations, and they say an infectious disease management in our country like Bangladesh, and resources constant insufficient access. There in my country, like Bangladesh, we have insufficient access to PPE, like gloves, masks, during clinical rotation. So the nursing student cannot combat in this, and they have due to this insufficient access, so that this transmitted the infectious disease so easily from one to another. So the other thing is the lack of institutional system to ensure adequate supplies during outbreak. And then there's a misinformation risk. There's over reliance on social media and non-academic. So we highlight that there's the academic curricula. There's a we must have the knowledge and must have more informations about infectious disease and how to handle them, how they transmitted from one another, from animal to males. And for this, the uh, well-developed country like Australia, we wanted also in our country that we we want sufficient access PPE for our institution, for our nursing colleagues, so that they can handle all these cases. So the implications, these challenges reduce student readiness to manage infectious disease outbreak effectively. Can you share the slide? Thank you so much. So the upstream interventions for improvement, what can be done to address the challenges? What can be done? The, we can policy reform in nursing education, resource planning, and protocol development and dissemination. So in policy reform in nursing student, we can say that the introduce mandatory courses focus on outbreak preparedness and infectious disease management, incorporate to hand-on training, the simulations, the mock outbreak drills. In the resource planning, we can say that the established institutional policies and equitable distributions PPE to all nursing students. And the protocol development and dissemination, we should create a clear evidence-based guidelines for nursing students on infectious disease management, disseminate materials through educational platform and workshops. Can you share the sixth slide for me? So in this slide, we can say that the nursing leadership in infectious disease prevention. So the empowering the nursing student to lead the way, that we mainly focus in this case study that the leadership development, advocacy roles, and community engagement. So the nursing student leadership development is so much important in this case. Training nursing students to lead the infectious control uh, teams during outbreaks, well equipped, well maintained, and the nursing students should train well so that they can handle the and combating the infectious disease prevention outbreak in our country like Bangladesh. And we can see the advocacy role, advocacy for health policies, and that support availability and robust to the and dispels misinformation. And next slide for me. Thank you so much. Then in this case, the first conclusions. The conclusions and the conclusion part, the previous slide.
Okay, sorry. Hang on. No.
Uh, the conclusions part and call to an actions. The lesson learned that not hinders nursing students preparedness for infectious disease outbreaks. For this, is the recommendations for the educators that the inter outbreaks specific courses solution into nursing curriculum. So the nursing curriculum must be enriched with knowledge, enriched with much knowledge with infectious disease control, outbreak, and how they handling. Um, and for institutions, ensures constant access to PPE and resources for students. So there is a adequate supplies for PPE like gloves, sanitizers, masks, etc. For the policymakers, the promote nursing leadership roles in public health initiatives. So what is the call to action? The collaboration between educator, policymaker, and healthcare leaders is essential to prepare future nurses to combat global health challenges. Thank you all for your attention. I look forward to your questions and sorry for the I have a technical issues in my device, so I'm apologize for that. And and thank you so much for hearing me. And thank you so much.